what are we going to talk about on this webinar? Why have we invited our audience? So, Sunny, with our global healthcare team over the past 12 months, has conducted a series of interviews and to develop case studies with executives around the world, leading marketing teams with pharmaceutical, medtech, and diagnostic companies, all of them being multinational firms focused on expanding access to innovation across global markets. Now, what's interesting from these case studies, we not only developed a series of best practices and in some instances pitfalls or what not to do, but also conducted extensive research on the topic to understand exactly what are the opportunities moving forward in the new environment to accelerate the impact that these investments have on getting your innovation to patients. So over the next 45 minutes to an hour, we're going to discuss the key challenges facing healthcare companies in hybrid engagement, exploring strategies and solutions, and more specifically looking at real life case studies. And at the end, we'll have a short Q&A session. Now, I want to jump straight into it, Sunny. So I'm going to bring you into the mix. Can we start off with a simple yet very important question? Can we define hybrid engagement? What does it mean in today's healthcare landscape? And then I think we'll get deeper into your insight specifically on what it looks like for healthcare in particular.
Absolutely, Alec. Hi, everyone. Thanks so much for taking the time to be here. So I think to answer your question, Alec, I think first of all, hybrid engagement in healthcare is an evolving concept. And every client we talked to during the last year throughout our research has mentioned something different about hybrid engagement. So some clients call it phygital, combining the word physical and digital. And another commonly used word is omnichannel. So I guess no matter what it is called, essentially what hybrid engagement does is to combine both analog and digital approaches to interactions with both internal and external stakeholders for healthcare companies. And of course, the goal is to enhance the value of the core products and services while at the same time optimizing operation efficiency internally. And I think for the purpose of our conversation today, as well as in our reports, we focus on external stakeholders. And I think we all know that the pandemic COVID-19 has a significant impact on hybrid engagement strategies for companies. And some companies said that digital engagement wasn't really a thing before the pandemic, while some other companies mentioned that they started working on building their digital platform back in 2018. So we can see there's really a variance of the different stages of maturity each healthcare companies is before and during the pandemic. But I think overall, we can all agree that the pandemic acted as a catalyst for the adoption of hybrid engagement, forcing healthcare companies to explore digital alternatives when traditional methods such as face-to-face meetings and also conferences were no longer viable. And I think the question now is that when, like in 2024, like where we stand now, when physical engagement has long become possible again, the new questions facing the healthcare companies are, what's the right balance between digital tools and live engagement, and how should companies adjust their pandemic strategies to the new normal? And those are the questions we get frequently asked by our clients. And I think in our recent executive roundtable, we asked all those companies, all those leading healthcare companies, that have they settled on the correct mix of digital versus in-person engagement with external stakeholders. And I think 67% of them said no. they're still trying to identify the right mix, while the other 22 said yes, but it was very challenging. So I think this is just an example to show like healthcare companies are really trying to figure out like what's the best strategy going forward.
Hmm, fascinating. So maybe you can elaborate a little bit more on achieving this equilibrium. How do we get there? And I think also you're going to talk a little bit about uh, how to prioritize strained budgets specifically, uh, looking at how we optimize resources across different channels, content. What are the best practices you found um, when it comes to making those decisions and trade-offs? And I actually that 67% numbers that was I think from just a couple of weeks ago. That's saying that they're still not comfortable with where they are. You know, I'm it just points that this is not going to go away. It's going to be an everlasting challenge. I think the target's going to keep moving. But I'm interested in what your team discovered looking at these specific best practices in the area of optimization.
Yeah, definitely. So I think before we dive into like all the solutions, and you also mentioned there are different kinds of challenges associated with coming up with the best strategy. Right. So I think based on our conversations with the healthcare executives, we find three major challenge: balancing priorities, optimizing resource allocation, and also improving the efficiency in operation internally, basically. And we can talk about them one by one, but I think we all agree that each is critical in achieving effective hybrid engagement strategy. And each one is very hard to tackle. And we see a lot of cases that companies get wrong in each of those three different stage.